A very good evening to all our viewers, and welcome to this week's edition of The Agenda. Of course, we are continuing to converse via distance because of the current COVID situation in the country. And today I'm very excited to be joined on the show by Dr. Peya Mushelenga. He's the Minister of Information and Communication Technology who recently tested positive for COVID-19, and he's on the show just to share with us his experience, especially the fact that he has been, or he was vaccinated already. And also on the panel tonight is Dr. Armid Azadeh. He is a doctor here in Namibia and also a public health specialist. Welcome, Minister. Welcome, Dr. Azadeh.
Thank you very much,
Thank you, Tolga.
everyone. Good evening, viewers.
Indeed, indeed.
Good evening, viewers.
Yeah, thank you. So I'll start with Minister Dr. Mushelenga. I think a lot of people, they found it very strange, and that is really due to the nation is still getting to understand how this vaccine works. So a lot of people did not expect that you would be infected after having been vaccinated. But tell us, Minister, when were you vaccinated, and if you don't mind, which vaccine did you take?
I was vaccinated towards the end of March. That was when I took my first dose. I took my second dose towards the end of April, and I tested COVID positive by the 14th of this month. I went to get my test, and I tested positive. Came about 4 or 5 days later, and I had been with Sinopharm.
Okay, thank you, Minister. So, when you got tested, was it because you felt sick, or what were the circumstances around your test? Or you were compelled to test for something else? How did the test come about?
I was tested because of a close contact that tested positive, and when I learned that this close contact tested positive, I felt sorry for me to take a test just to be sure where I stand. I did not go because I had any symptoms or because I was feeling any sick, any headache or coughing or flu or whatever, but I simply went because of that close contact that tested positive.
Indeed. Thank you, Minister. So, Dr. Azadeh, listening to the Minister's version there, does it make sense from a medical point of view that after taking both vaccines that it doesn't really surprise maybe that he didn't feel anything?
I think definitely this is something, I've witnessed with the patients that we're managing at the moment. Those that have had their first or even their second dosages some of them are still catching COVID, but mostly they're getting very mild symptoms, if at all, and they're not ending up in hospital. And that's precisely what we want from the vaccine, is to prevent the severe infections.
Indeed. And just while I'm still with you, Doctor, if we look at the daily updates by the Minister of Health about the COVID situation, there are pockets of people who died after having been vaccinated, especially after receiving the first dose. Just again, from a technical point of view, what could be the cause for that? Is it because maybe the safety time did not pass yet after being vaccinated? Or what are the sort of clinical explanation that you can think of?
So there were a few cases of vaccine-induced side effects around the world, but these are extremely rare, especially the ones that cause sort of a fatality. The blood clots and those sort of reports that came out from the Johnson & Johnson or AstraZeneca sort of testing rollouts. some of those sort of halted the rollouts for a while they were checking them, and then they carried on rolling out because it was a tiny percentage. What we're witnessing now is not those side effects in terms of the pockets that you mentioned that developed COVID and actually sort of maybe succumbed to COVID. What that actually happened was very early infection and not having enough of an immune response. So we know that the vaccines typically come in, for most of the vaccines that are being, available around the world, it's a 2-dose. So you get the first dose, which gives you the start of an immune response, and then the second dose, which is usually 1 month or even up to 12 weeks, like the AstraZeneca is recommended to be 8 to 12 weeks later, so which is about 2 to 3 months later. And you need that second dose to get that nice bounce in your antibody levels, which is what you're looking for to provide that immunity to coronavirus. What we're seeing now, and I suspect has happened in Namibia, is the people who suspect or are scared of COVID because they may have been exposed. They know that someone in their vicinity or at their workplace tested positive. They see the rising infection rates and the rising, death counts, and then they rush to go and get vaccinated, while they may have actually been in that incubation phase of the virus. So there wasn't enough time for the vaccine to have its effect to get that antibody response. But if you look at the tallies that our minister is releasing every day, it's a minority that have one vaccine that are actually dying, and I've seen very few, if any, that have had confirmed double doses who end up sort of dying from the disease.
Minister Mushelenga, you were one of the first government leaders to go for vaccination, and you have helped to inspire a lot of people brave action because, of course, the the vaccination rollout was only beginning really, and people had a lot of doubts, and you were one of the brave few leaders who came out first. In hindsight today, especially after your recent infection, do you feel vindicated by your decision at the time to have gone that early, and therefore maybe even thinking of what the consequences would have been if you had not, if you had delayed your vaccination?
Thank you very much. Indeed, as you said, I was actually the first cabinet minister to be vaccinated. I was vaccinated the same week as the deputy minister of health. But for the cabinet ministers, I was the first cabinet minister to be vaccinated, despite the fact that there were so many campaigns, anti-vaccination campaigns going on. I decided to go and lead by example. And rightly, as you said, I feel vindicated for the decision that I took. I believe if I had not taken vaccination, perhaps I would have been struck by the pandemic or by the virus to a larger extent than it was the case now. Now that at least I have some immunization in the body, I was able to fight the virus, that I did not really get the symptoms. I was not hospitalized. I did not lay in bed. Of course, I had to go in self-isolation for various reasons, that I do not infect other people, also that I do not get exhausted because the virus was within my body. Although I'm immunized, at least the virus was there. I had to do lighter activities, not to overwork myself until such time that I exceed the period uh, of the virus.
Seem to have lost you a little bit there, Minister, but I think you are back now. Um,
Yes.
just again a follow up to you, Minister. What was the, you know, What was the motivation for you, especially against that background of so many anti-vaccine campaigns going on at the time? They are actually even worse now. Um, did you read up a lot to satisfy yourself? Where did you get to go for your jab?
Yes, by then I have seen and I have read a lot about the vaccination in a number of countries. And one would know that people would not unreasonably produce something, give it to their own people when they know it is harmful, it has a harmful effect. For example, the Sinopharm that I took is widely used in China. And I had to take it, one, to protect myself and to keep myself stronger so that when the virus attacks me, at least I have some degree of immunization and which will be able to resist the virus. Secondly, is to instill confidence among people that might be having fear so that they can really see that this thing is working.
Indeed. Dr. Azadeh, why don't you tell us about the fact that there is a surge in infections in Namibia just at the time when we are rolling out this vaccination drive, because it has also helped feed into the theories of the anti-vaccine gang, if I can call them that way. Is there any correlation at all? Is it by design or by default?
I think it's a sign that our vaccination campaign hasn't been quick enough. Um, I must congratulate our minister for being one of the first ones to do it. That has helped definitely the conversation around vaccines. I went and did my Sinopharm vaccine also in must have been April, and then the second one in May. And a lot of my medical colleagues, some of them who got infected over the last year, being exposed in the clinical setting, also rushed to get the vaccine as soon as it was available. So we've all, pretty much carried on working, and a few colleagues who maybe didn't finish off their vaccines have subsequently gotten sick again, but not as severe. What we're seeing at the moment is a very different wave. This third wave is already more than double the magnitude of our second wave, which was in December. It has a few factors probably contributing to that. I think on the one side there is it is the colder winter months, and our society's behaviors are different. We huddle a lot closer. People have what they call pandemic fatigue, so they're not wearing their masks as often. They are not obeying social distancing rules. There's get-togethers, parties. There's been a lot of gatherings in the last month, which has now causing this spike in infections. And lastly, although it's not proven that we have the Delta variant, the variant of concern, I'm quite confident that we do have the Delta variant or other variants circulating, and that's why we're seeing a much higher infection rate and a much more severe infection rate. I was working in the hospital yesterday, and essentially we're seeing very young patients with severe respiratory symptoms in that first period of infectivity. They're coming in with low oxygen levels, a real pneumonia. And subsequent to that, once they've even recovered, we're having a delayed sort of post-COVID ARDS lung issues that they're having, and their lungs are stiff and their oxygen levels just don't come up. And that's been a very critical period with a lot of our patients, young ones who are in their 30s and 40s as well, with no real comorbidities. If I look at the patient base there, the minority of them really have a vaccine status that would have been ideal. So, it's very easy ammunition to say, oh, we have vaccine rollouts and now we're having infections, that's the cause. But if you look at the data, it's not the case, not at all. We have only 4% or less than 4% of the population vaccinated. I think the last I saw was 2.6%. And yet our infection rates is much more than that. Those who are getting infected and those who are dying are not the 2.6% that have been vaccinated. If we look in contrast to countries that have 60%, 70% vaccine rate levels, they are actually moving forward with life. They have, more public gatherings, larger numbers. Yes, they're having a spike in infections as well because that comes with opening up more. But they're actively rolling out these vaccines. And the latest data we're getting from these countries is that the vaccines seem to be helping against severe infection, which is what we want. Sometimes there's a bit of a question, is it effective against the Delta variant? Or is it as effective as it should be? Sometimes there's some positive feedback or some studies, and sometimes there's some questionable studies. But right now, really, vaccines is the best method of tackling this pandemic and curbing this wave, because preventing it is definitely something we can do. Whereas treating it at the moment, there's just a lot of questions with regards to what do we have at our disposal that we can actually treat this virus.
Indeed. We are going for a short commercial break and we'll be back shortly.
Make sure you catch Africa Good Morning every weekday from 7 a.m. to 8 a.m. with a rerun from 8 a.m. to 9 a.m. hosted by Aina Raizakweyo and myself, Ashwin Dedi, as we bring you all the news you need to know happening in the SADC region and beyond.
Welcome back. We are having the agenda of this week with Dr. Peya Mushelenga. He's the Minister of Information and Communication Technology, and also Dr. Armid Azadeh. He is a doctor, he's a public health specialist, founder of DocMec, a telemedicine services provider here in Windhoek. Gentlemen, we continue. Dr. Mushelenga, tell me about the mood in government right now, given the rise in the number of infections in the country, the challenges that, of course, are facing our health public system right now, but also the fact that so many prominent people have passed away, even this week. The likes of Dr. Zed Ngavirwe, former Minister Ngarikuto Kashiryange, paint for us some sort of picture. Of course, I know that you're probably confined to your home now because you are still recovering, but I'm sure you would have an idea of how the mood is.
Yes, rightly as you said, I'm now confined. I'll only be out tomorrow, Monday. But from what I have been following, the government is taking this virus very serious. We have seen the president went out to inspect the facilities and to look at the oxygen supply, look at the hospital. The Minister of Health and his team have been working 24 hours around the clock to address the crisis. So that shows that government is taking the virus very serious and is committed to addressing the problem. That's why you have also seen those measures that have been taken with regard to regulations, like putting Windhoek, Kahanja, and Rehoboth local authorities under lockdown and reducing public gatherings up to 10 people. So it is now for people to start complying with these regulations. I see time and again the police are working very hard fighting with the public who do not want to comply. We are not doing this thing for the police. We are not doing this thing for the government. We are doing it for our own, because we need to be safe in order to overcome the pandemic. We are already a small population and we cannot afford to lose so many people because of the pandemic.
Indeed, indeed. Thank you, Minister. Dr. Azadeh, I could actually say that you are intimately involved in the whole process right now of battling this virus from a clinical point of view. When you go to facilities, and I think you alluded it before the break, the kind of situation that is now existing at public facilities, maybe not only public health facilities. When you go to hospitals, maybe to go and deliver some of your services, and whether private or public, what, what kind of picture can you paint for us as far as the state of those facilities are, given the pressure that everybody is undergoing right now?
I'm not sure if you saw the social media clip of Karatura Hospital casualty a few days ago, where they were essentially it was a COVID ward. Lots of patients on oxygen, a few patients who had passed who had the covers over them. That's not far from what the private facilities are looking like as well. Essentially, what we're seeing now is the health infrastructure and healthcare services grinding to a halt and sort of under severe strain. The problem is now, a few days ago, I had a patient who doesn't have COVID, had diabetes, and seemed to be uncontrolled. And she went to Karatura Hospital and was told, no, we only looking at COVID patients. This is a COVID hospital. Then she went to Black Chain Clinic and was told the same thing. So essentially just the breakdown of normal healthcare services where patients need care for their blood pressure, for their diabetes, for their HIV and ARVs. All of these services are also getting backlogged and breaking down. And so general healthcare is under more and more strain. And patients who are normally having their healthcare taken care of by whether it's in public or in private are not able to. On the one extreme, we see that with the state, which is looking after everyone, because there are private patients who are ending up at the state hospital as well, looking for oxygen because there was just no beds in private. And they're looking after everyone. So really, the state facilities are under tremendous strain. We've seen appeals from consultants and medical officers looking for help in doing ward rounds, etc. And so the whole fraternity is a little bit tired, overworked, and I think the morale is starting to go down, especially with this wave, because we are having patients who should be healthy. They're your age, they're colleagues, they're friends, they're family members of friends, and you just see them sort of slipping away in your fingers, and there's just nothing you can do. The prognosis for certain patients who sort of really struggle to get air in their lungs, whether you have them on a ventilator or a CPAP machine, they just sort of desaturate, they decompensate, and they're gone, in a matter of minutes to hours if you're lucky. And this is sort of really, taking away the morale. The nursing staff are tired, they're overworked, and they're scared too because, they don't know if they're going to get sick themselves as well. And a lot of their colleagues have been off sick, so people are working extra hours overtime. So it's, we saw something like maybe at a grander scale in India, but we're starting to understand what, at least from a clinical services point of view, what was happening in New York when they had their big wave at the beginning of the pandemic, and what's been going on in other countries like India and Nepal and South Africa in some of the Eastern Cape hospitals, a few months ago as well. So we've seen those reports and those videos, and now it's starting to hit home because we're seeing it in our own facilities. And then on top of that, we get frustrated by patients who are not vaccinating, who are not wearing their masks, and who are sort of, using believing in every home remedy and telling other people to trust that rather than at least what we do know works. So that's a bit of a frustration.
Indeed. Before I go back to the minister, I still have a question for you, Dr. Azadeh, and that is, people are saying the one silver lining of this virus is that by the time it we overcome it, our public health facilities in particular will be better equipped, given the amount of efforts that are being made so far to sort of equip them and deliver some of these logistical solutions. Do you subscribe to that view also, that if COVID, if the pandemic itself subsides at some stage, that our health facilities, especially the public ones, will be in a better shape going forward?
I think probably a yes and no to that question. Um, in the ideal world, yes, we would be investing a lot in building up our health infrastructure so that we can deal with future challenges. The problem right now, I think, is that a lot of the resources are being put into just putting out fires and not really addressing the system problems that exist, the under resourced, the under financing, and the infrastructure weaknesses, because that is the issue. And maybe the silver lining would be that the pandemic has brought to light how weak our healthcare system is, and so therefore we know what we need to fix. But through dealing with this crisis, I don't think it itself is going to be providing the solutions. It's probably just more bringing to light just how much of a problem we do have.
Indeed. Minister Dr. Mushelenga, we are dealing with the pandemic of the disease, the virus itself, but there's also a pandemic of misinformation, if I can call it that way. As a minister, of course, I know that the mandate really lies with the Ministry of Health to debunk some of these myths. But of course, I'm sure as a Ministry of Information yourselves, you are also playing some role to spearhead the true message for this vaccine. What sort of efforts can you share with us that your ministry is occupied with as far as this matter is concerned?
Thank you very much. The ministry is using institutions, the media institutions, not only public but also private, as we are doing right now, in order to dispel that notion and those anti-vaccine campaign. This is not an issue that should divide us as a country according to class or political differences or whatever. It is an issue that we should all unite in order to fight the virus, because the virus does not discriminate when it comes. It does not look at who and who. The truth is, if you are not vaccinated, you are vulnerable compared to those that have been vaccinated. And when you talk to medical and health professionals that are working in the wards where these people are lying, they will be able to confirm what I am saying. The difference between people that have been vaccinated and those that have not been vaccinated. So the ministry is therefore working very hard, hand in hand with the Ministry of Health, to take the message across to the Namibian population. No one is forced to take the vaccine, but all we are saying, we are encouraging people to take the vaccine because it is for their own good health.
Thank you, Minister. Thank you. We'll go again for a small break and we'll be back shortly. And we are back. We are in conversation with the Minister of Information and Communication Technology, Dr. Peya Mushelenga, as well as Dr. Armid Azadeh, who is a public health specialist and also a doctor himself. Just to go back to the Minister again, we have seen countries coming. Of course, this is a global pandemic. It affects every country, and every country is prioritizing its own citizens. But we've seen countries like Cuba at some stage sending doctors to South Africa to go and help our neighbors to combat the virus. And this week I tweeted a question, basically, you know, in the political circles, there's always this message, this rhetoric, this sloganeering in the political space, our all-weather friends. We refer to some countries as all-weather friends of Namibia. Where are they when we need them the most in this time?
Thank you very much. Our all-weather friends are all over. I am not aware of the fact that we reached out to them to send doctors here. As I told you, I have not been in the office. I believe that is now for the Ministry of Health to know whether we need to invite countries to send doctors here. And I'm sure if Cuba is to be requested to send, I do not see the reason why they will not respond if they have a team available. But as I said, I have not been in the office for the past 2 weeks, and the Ministry of Health would know better what assistance has been requested from which country.
Thank you, Minister. Dr. Azadeh, I'm
Before
sure
we
you've
go
been
ahead,
following.
excuse me,
Yes,
before we
Minister,
go
please go
ahead,
ahead. Yes, please.
as we say, all weather friends, you must know that already they have doctors that are working here in the country. We have Cuban doctors that are working here, sent by the government as part of the bilateral issues between the two countries. So you cannot completely say they are nowhere when we need them because they already have a team in our country. Perhaps in other
Thank
countries
you.
where they are sending teams, they never had teams there before.
Thank you for that clarity, Minister. It's very true. We do have quite a contingent of Cuban doctors here. And of course, we heard this week that Cuba has made some breakthrough in terms of coming up with their own vaccine. Hopefully, if it is clinically sound to be used here, we hope they would extend that hand of, of sympathy and empathy towards us. Uh, Dr. Azadeh, I was going to ask you, as someone who I'm sure monitors the developments in other countries, and you alluded you alluded to it briefly a while ago. The the countries like the UK seem to a very great extent, won the fight against this virus to a very large extent, especially from the severity point, not very much from the infection point of view. Um, there is a European football championship going on in Europe right now, and it's still full. When the final of that competition takes place at Wembley in a few weeks' time, they will allow up to 60,000 people into the stadium to watch this match. Is that a vindication of what you are saying all throughout, that indeed this is the only way to get our countries back to where they were before?
Look, life may never go back to where it was pre-pandemic, but we are looking for some sense of normalcy, or the next, or the new normal, as they call it. And right now we are in a sort of crisis phase. Whereas if you see a lot of the other countries who have had the resources and had the sort of the public buy-in to to their governmental policies and lockdowns and rollouts of vaccines, they are approaching some sense of normalcy. It's still far from what it will be, and it probably will never go back to what life was like before. So I think I was also reading about Singapore the other day. They have, it's a small island, so it's very hard to social distance. Namibia, we're blessed with wide open spaces, and we can really social distance very effectively. Whereas they have, it's an island nation with, several million people living on this island, very closely together. And also they have very vulnerable populations, very old, etc. But they just recorded their 34th death overall. And they have similar number of infections, 70, 80,000 infections confirmed in the country. And it just showed how effective their public health measures were in that small country. They're obviously a very disciplined nation. They all started wearing masks very quickly and started vaccinating as quickly as possible. But they haven't come up with some new way of treating COVID that the rest of the world doesn't know about. So it can be done with relatively simple methods. Obviously, they have a very good healthcare system, and there's probably as many ventilators as they would ever need. But it's not the ones patients who are on ventilators necessarily that having enough ventilators is not the solution to this pandemic. So yes, vaccinating is probably the best way we can get to moving forward, both in our lives and our livelihoods as well, which is very important. The economic impact of these shutdowns, sick leaves, disrupting business. We're still, we're shut down now for tourism, for example, which is such a significant part of our economy. That will have far-reaching and long-lasting impacts on the health and our prosperity. So really moving forward is not a question of just, saving lives, but it's also saving livelihoods in the future, because our economy depends on moving forward.
Yeah, and while I'm still with you, Doctor, you spoke about then what how important a catalyst it is in fighting this dreadful virus. You spoke about social distancing, which has been some of the effective tools that the likes of Singapore have used to manage to be where they are today. But I'm just curious, and I came this close to publicly making a statement this week, but I felt I should restrain myself. The fact that the people who are dying right now in Namibia are mostly the elderly, and I do not believe at all that these elder people went out houses and came into contact with infected people. I have a even that could be very wrong, really, that that lack of discipline among young people, and we've seen videos even last weekend of police closing down some places after the declaration by the president last week that bars and other places must close early. Do you think that young people are in a way very ill-disciplined to the extent that they might even be taking some of these viruses home to their elder parents, and the fatal consequences are what we are seeing now?
I think, we don't know for sure, obviously, and every case is different. But I also have a strong suspicion that a lot of the vulnerable populations are exposed by their family members who are still in circulation, going shopping, going to bars, and also going to work, for example. Um, you know, this pandemic has actually brought to light interesting cultural dynamics, right? So as a society, the more selfish you are, for example, you look after your own well-being and your own interests. And this pandemic is not something that one can just look after yourself. The whole act of wearing a mask, for example, wearing a mask doesn't decrease your chances of catching COVID. It actually helps other people be protected from you. So it's actually a outward sort of sentiment. When you wear a mask, you're protecting your community and your environment and your families, your co-workers. Vaccination is two-pronged. By vaccinating, you protect yourself, but you also protect your community. So there's a lot of people who are suspicious or they're worried about the vaccine. And that is fine. It's still a voluntary thing to take a vaccination. But for you to actually discourage other people, other family members, and then inadvertently expose your parents and aunts and uncles, we're seeing those are the ones who are sort of passing away now. That is negligent, in my opinion. It's your opinion, it's your decision. It's your if you don't want to vaccinate yourself, but don't go and expose everyone and don't tell everyone not to vaccinate, because that is the public health message. That is what the Ministry of Health is trying to do and what we as a nation should be trying to do. Not just protect yourself and your own interests, but really protect our communities and our vulnerable populations. And
Yes.
in fact, this current wave, if you look at the the people who are dying, it's not just elderly anymore. You know, you find a lot of relatively young people who are heavily affected, and they get affected very severely. They are also starting to die now. I see it in the hospital where there's a lot of 14-year teenagers. Even last night I saw, but 40-year-olds, mid 30s. And if you look at the listing of sort of people who die, most of them it says comorbidities. So I don't, and I think that may be a little bit misleading in terms of everyone thinks, oh, they were sickly. But by the age of 40, the majority of Namibians have some sort of comorbidity. They may have a slightly high sugar, they may have a cholesterol, they may have a blood pressure that they take medication for, and that then lists them as having comorbidities. So the majority of people in that age group will be classified as having comorbidities, but they're actually healthy, like you and I, and they're getting affected by this virus.
Indeed. Thank you, Doctor. The final question goes to Minister Mushelenga, and that is, I'm just curious as to the, how do I put it? Our government is really facing a mammoth task in overcoming this virus. And this virus actually compounds so many challenges that our country was already facing. Is this sort of the worst time to be to be a senior government official like yourself, or is it actually the best time to sort of, if anything, to prove that this government is capable and will overcome all these challenges?
There is no worst time and the best time because it depends on which angle you are looking at it. But we all believe that this pandemic is not unique to Namibia. It is worldwide. It's how we respond to it. And I think so far the government has tried its level best to respond to the pandemic to the best of its ability in terms of getting the vaccination, in terms of putting up emergency health facilities. Of course, the number of the people that are sick and the facilities that we have a high number. It was quite a breakout, particularly here in Windhoek in the past months. But government is trying its level best. It's showing its commitment. It's showing that it is caring. And really, I like to repeat again, it is now really for people to comply. It doesn't help for us to come up with propagandas against the vaccines. It doesn't help us to deliberately violate the regulations that are put there, because at the end of the day, it is all done for our own benefits, for the sake of our health.
Indeed. Minister, thank you very much for your time. You are still recovering and you still availed yourself today to be on the show. So we wish you a speedy recovery so that you are back on your feet very soon and continue your work. So we wish you and all your colleagues in government the best of luck in overcoming this virus. And to Dr. Azadeh again, thank you very much for yourself in a time when I'm sure you on another day you would have been running around still treating your patients and providing services that you do. So thank you very much for sacrificing a very large portion of your time today to be with us. And all the best also in your work, really in helping everybody to recover.
Thank you and
Thank
good
you,
night.
Toivo.
Thank you, gentlemen. I appreciate it.
If you're feeling how I'm feeling and you know I won't stop, all we gotta do is take our love to the top. If I got it and you want it and you'll never let it drop, all we gotta do is take our love to the top. I will ride for you, maybe even die for you. When I'm loving you, but my heart don't stop.